Today we are very excited to be here with Dr. Laurie Marbas. Now, Dr. Laurie Marbas is a board-certified family medicine and lifestyle medicine physician. She's a wife, she's a mom of 3, and she's an avid runner. She utilized whole food plant-based diet with her patients for years in rural Colorado, and then as the former medical director of the Dr. Furman's Health Oasis in Boca Raton, Florida. Dr. Marbas is the managing editor of the first medical journal for plant-based nutrition called the International Journal for Disease Reversal and Prevention. It's an open access journal that anyone can access. You don't need any special privileges. If you're interested in learning more about that, visit ijdrp.org. She's also the host of the Healthy Human Revolution podcast, which also has a website that has online self-guided classes for individuals who want to transition to a whole food plant-based diet, and many resources for parents to help their kids also eat healthier. Her team at Healthy Human Revolution are experts in whole food plant-based nutrition, but more importantly, they are also experts in teaching others about motivation and habit formation. So they really take something that's scientific and turn it into something very practical. You can learn more at healthyhumanrevolution.com. Dr. Marbas, you've been on the Mastering Diabetes Online Summit for, I believe this is your 4th year in a row, if I'm not mistaken. We always love talking with you. You're a machine and you're a force for good. So thanks so much for being here with us today.
Well, thank you. I'm so honored that you would even consider asking me again. It's such a joy to talk to both of you.
Absolutely.
It's great. And you've helped so many of our clients as well over the years, which we are thankful for.
Your clients are some of my favorite patients, even if they're difficult. You guys send me the really tough cases. It keeps me on my toes, but we've had some really phenomenal success. So actually, thank you for allowing me to be part of your community.
100%. You're part of the reason why Mastering Diabetes gets such great success with our clients. There's no question. Now, today we wanted to focus a little bit on kidney health because there's a lot of confusion about how foods influence kidney health. And between the low carbohydrate world and the plant-based world, there's sort of a lot of, there's conflict and there's a lack of consensus about what is actually the best way to improve kidney health over time or to reverse an ailing kidney. So many people living with diabetes, regardless of the type, are also diagnosed with kidney disease at some point in their evolution, or they're afraid of developing kidney disease because they've heard about it and it's impacted somebody that they know and love. Can you tell us a little bit more about how insulin resistance and kidney health are related?
Sure. So some of the things that, as a primary care physician, and we get, we're the kind of the first ones in the trenches, so to speak. We're on the front line of diabetic management and health. So one of the things that we're always taught is to keep an eye on that kidney health. So what we'll be looking for is, are they spilling protein into the urine? Are they, escalating in their creatinine, which is a blood measurement of kidney health? So some of the things you got to understand about the kidney, it's a filtering system, right? So you have these tiny little filtering systems called glomeruli. And so think of them as little daisies. So we want, for example, if I have someone with high blood pressure and the blood pressure is really strong, it can obliterate these little filtering systems. And what can happen over time is you can start spilling protein into the urine. So that's one of the things that we look for, because diabetics can also damage the kidneys. And nephrologists will tell you that you will want to eat a lower animal protein diet to preserve your kidney health. So, insulin resistance, it's the first stages as we move into prediabetes and diabetes. These are the things that we worry about, is certainly kidney health, because, the folks that are on dialysis, where they actually have to use machines to do the kidney functions, the number one cause of that is diabetes. And so what we want to do is put you in a position to where you don't have to worry about diabetes or your kidney health, and that's by eating plants.
Can you go into a little more detail here about how a person would know that something is going wrong with their kidney? Like, what symptoms would they experience?
Yeah, it's a little bit interesting. You don't really, at least the patients that I've worked with over the last 15, 20 years, they don't really see a matter of like a feeling. They don't have back pain. It's not a painful experience. what they would see is that their blood work that they're getting regularly, they're starting to see some changes in some of those parameters that we're looking and measuring, the creatinine and then the protein in the urine. So those would be the things that we look for. You may see that you have bladder infections more frequently. For example, a very close family member has had a kidney transplant. It's been over 20 years now. And when she sticks to a plant-based diet, she does really well. Her kidney function is doing very, very well. There's less of a concern that she's going to have to require another kidney transplant. But when we fall off the diet, we can see some changes in her kidney function. And that goes along with my other patients as well. But the main thing is it's not something that there's not a sign. It's not like when you first develop diabetes and maybe someone gets where they have to pee a lot, or they have rapid weight loss and they feel very fatigued. It's something that needs to be monitored. So it's really important that you go to a physician who knows the guidelines to be checking that and to ask for that. And then also ask, what are my results? How do they compare to last year? Because the best defense is a good offense. And that's part of that, is being educated about your own health and where you're currently at.
Okay, so one of the things that you've mentioned multiple times here is protein leakage, and using that as an indicator of of kidney health. So could you go into a little bit of detail here about why protein? Why is it that doctors are monitoring the ability of your kidney to actually filter protein and using that as a surrogate of kidney function, when your kidneys are in reality filtering thousands of metabolites 24 hours a day?
Sure, absolutely. So remember, the kidney has those small filtering systems, which I had mentioned before, the like little colanders. And as the blood flows through, the kidneys are working really hard because, every time that heart contracts, it's filtering some more blood. And those little colanders the hole shouldn't be big enough to let protein leak through. So the reason that we look for protein in the urine is because it shouldn't be there. So when we find it there, we know there's been some stress to the kidney and there's been damage to those little filtering systems. So those are one of the key indicators, and that's called microalbumin. You'll get a test. You should have that at least done once a year as a diabetic. And then if you find that it's high, then you'll need to be seen by a nephrologist. And it's unfortunate because, 1 in 8 humans, or especially Americans, suffer from chronic kidney disease, and many of them don't even know they have it.
What's the standard treatment? Once this is happening, once this is progressing, what medications are used? How does that go?
Yeah, so what we're looking for, what you'll see as diabetics, you get a slurry of prescriptions. So you'll get your metformin is typically one of the first ones you'll get, but you also get what we call ACE inhibitors, something like lisinopril, that may sound familiar, or losartan, it's an ARB, if the ACE inhibitors cause you to cough. And those are being protective measure, and they're usually prescribed at a lower dose, even though they're high blood pressure medications, even though, let's say, our diabetic maybe doesn't have high blood pressure, at least according to the current guidelines of high blood pressure. That's meant to be a protective measure. And there's the physiology of that, it can be but first thing is typically medication. There's not much education, in my experience, that goes on as far as like, hey, we need to really worry about your kidney health other than controlling your blood sugars. And of course, we know how the standard medical practice goes with that is just, don't eat the carbs and try to keep the sugars under control with your medications. But that doesn't really help our kidney health in the long term.
Okay, so that was the perfect segue to my next question here, because most people living with any form of diabetes, they're influenced into eating a low carbohydrate diet because they believe that if they were to eat carbohydrate, that the glucose would go up. So as a result of that, they eat more meat, they eat more dairy products, they eat more eggs, they eat more fish, which are all technically low carbohydrate foods, but they're also higher protein foods. So by eating a low carbohydrate diet, de facto, they're eating more protein. What does that do to their kidney health over the course of time?
That stresses the kidneys even further, right? So it's kind of like beating our head against the wall and expecting the headache to go away, right? So you're pounding your kidneys unknowingly, because a lot of people don't understand that the high protein is harsh on the kidney health, in hopes to lower the blood sugars, in hopes to prevent everything else, but it just makes everything worse. So that's the unfortunate thing. It's almost like watching a comedy, right? So we understand that a whole food plant-based diet can certainly reverse many cases of type 2 diabetes and get your type 1 diabetes under very good control with, the least amount of insulin required. But the frustrating part as a physician is that you'll see patients who have all these issues, including, their chronic kidney disease, and someone's telling them to eat low carb in order to, I call it the glucose, the smoke, right? The fire is the insulin resistance, and it's just, the glucose is just the smoke, and they're just wafting with different medications. But if we could just put out the fire, which is eating a whole food plant-based diet, everything else gets better. That's just the frustrating part. It's extremely sometimes difficult to help people understand there's a different way, because they're so entrenched in the regular medicine and what they've been told by multiple doctors.
Question for you. What is considered a high protein versus a low protein diet? Because people sort of use these terms of like, oh, when you're eating a high protein diet, then blah, 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 blah. But give us some indicator of, what exactly is high protein? Is it a certain number of grams of protein per day, or is it a certain percentage of total calories in your diet? And then secondarily, is there a difference in the way that plant-based proteins and animal-based proteins affect your kidney health?
Those are really good questions. So first of all, I'm a big fan of just eating whole foods. So when you do that, when you're eating a whole plant foods, you're typically, and depending on where you're pushing more towards fruit, like maybe some of the things that you're doing, or someone's eating more beans, you may be in that 10 to 20% of your calories are going to be from protein. You don't need more than that unless you're a high-performing athlete and exercising 4 or 5 hours a day, and maybe you can consume enough food to, actually contain the foods that you need in the macronutrients. So for a woman, 35 grams to 45 grams, and even males, not much more than that either in a daily basis is what we need. And actually, when you look at the actual food diaries of individuals who eat a whole food plant-based diet, oftentimes we're eating even more than that. So we're getting more than enough protein. So we've got a fascination with protein. So we can just, don't worry, you won't be protein deficient unless you're not eating enough calories. So if I have someone who is anorexic or has some type of an ability to consume food, that may be someone because they're not eating enough calories, or someone maybe in a burn unit, that's an issue as well. But for the most part, I'd say 10 to 20% is a healthy indicator. I don't like to say low protein or high protein. It's just like, this is just eat what your average is going to be. But high protein would be like a diet, like a ketogenic diet or something. But that's the damage that can occur where you're eating a high protein diet, especially animal protein. And I'll explain that since that was your second question, kind of segue into that. If you think about protein or animal products, so protein, you just don't get in isolation, right? There's other things that come along. There's saturated fats, there's trans fats, there's cholesterol, and there's a lot of things that occur when you eat animal protein or animal foods. So you get a lot of inflammation. So part of the inflammation that occurs, and that's where the damage to the kidney is happening. So what we're doing is when you cause inflammation and it's causing the kidney to have to work, it's hyperfiltration. It's like constantly having to do its job. It's doing more and more and recruiting more and more. And that inflammation is causing damage and scarring to the kidney. And that's when you start getting the protein leakage that we were talking about earlier. So when you compare people who eat the same amount of protein, animal versus plant-based protein, it doesn't have the same effect. So you're not getting that inflammatory response that you get with animal protein when you eat a plant-based protein. So that's the nice thing, is that when we have people, who have chronic kidney disease, you can actually see some improvement even if you already have this leakage. So, I'd encourage people, if you already have been diagnosed with some type of chronic kidney disease, to look, speak to your nephrologist, speak to your doctor regarding eating a whole food plant-based diet, which may actually be able to reverse some of that, if not all. I certainly have there's some interesting case studies of someone actually coming off dialysis. So that's really amazing and it's exciting. Doesn't mean they get complete function, because once that scarred down tissue in the kidney is gone, it's really hard to revive. It's most of the time it doesn't. But if you have any reserve and you're stop causing the beating them up, then you might be able to, kind of pull them out of the ICU, so to speak, and let them start working again. You might be able to see some significant improvement in your kidney function.
So you talked to us about putting out the fire with
right.
whole food plant-based diet. So can you explain how that lifestyle can actually improve kidney health?
Right, absolutely. And I've seen this over and over again. So having, let's say, patients who were on maybe a different medication for a very specific diagnosis that they can't stop, right? And it affects their kidney health. What's interesting is you'll see this elevated creatinine, and then we start talking about diet, and they may not even have diabetes or insulin resistance that we can see, and at least on labs, their blood sugars aren't going up. They may be younger. But what's interesting is they're on, and I've had this happen with patients, that's why I'm bringing this up, but they'll have a medication that they have to stay on. But I talk to them about diet, and we're talking about kidney health specifically, and I get them to decrease, even just decreasing the amount of animal protein had a phenomenal effect on their kidney health. You'll see the kidney creatinine start dropping pretty significantly. And so that's the key factor here, is that all parts of our body need to be protected, but especially, our kidneys and our hearts, these type of things, that's where the whole food plant-based diet, because we're nourishing it, we're putting in all these amazing nutrients and phytochemicals that are going to be able to bathe all of our organs and keep them healthy. But it will affect the kidney health. You can actually see the measure of the creatinine dropping significantly.
That's amazing. So you mentioned, you've done this with patients, and, we know that you're very prolific with working with patients. And that's kind of one of the fun parts about talking with you, is your experience comes from just a wide variety of working with people. And you've worked with Doctors on Demand for a long time and saw a lot of mainstream people coming through your practice. And you get a lot of plant-based people through, the community and through us as well. So are there any stories you want to share about successful clients who came to you with kidney challenges?
I would say the majority of mine are going to be my hypertensive folks, those with high blood pressure and those with diabetes, because these are the two entities or medical conditions that are going to affect your kidney health. And so that's the beautiful thing about plant-based diet, right? So it's not like you prescribe a medication and I'm trying to lower your blood pressure, right? Which may affect something else. Let's say it affects your sexual health, or it affects your mood, or it affects your weight. There's always going to be some negative ripple effect down the stream with medications. But a whole food plant-based diet, I look at it and I'm looking at a patient with high blood pressure. Let's say that's their primary diagnosis. And maybe their creatinine is just outside of the high normal, but that's not our main worry. They're not spilling protein yet, but certainly being stressed. How about that? But then we're talking about this high blood pressure that's on 3 medications and they're not getting any better, doing what they've been doing. They're escalating, medications and the prescriptions and the amounts. We put them on a whole plant-based diet. What happens? The blood pressure drops. Well, there's these beautiful ripple effects in the body. One, the fire hydrant is turned off and we're not blasting the kidney anymore. And what do we see? We see the creatinine start to drop and it becomes in this normal range. And I have had more than a few patients have that happen. More than a few. So that's the beautiful thing. And then I can stop medications that might be causing the other negative side effects as well. So that's the amazing thing.
Yeah, we had one doctor come on the summit a couple of years ago, Dr. Gibson. He basically said, hey, listen, you can't heal your body selectively. You can't do it, right? It's not like you can say, okay, just make my kidneys better, but don't touch my heart, or like make my brain better, but don't touch my thyroid gland, right?
Exactly.
Really
Exactly.
Okay, so since you're a master of teaching people how to transition, how to change your lifestyle, how to integrate a whole food plant-based diet, let's talk a little bit about that. Suppose you had a patient who was interested in becoming a whole food plant-based eater and adopting a lifestyle, but they didn't really know where to start. Can you give us some insight here into your methodology to teach somebody how they can start to integrate this lifestyle?
Yeah, it's funny because you guys mentioned Doctor on Demand, which is a telemedicine service, which I worked there for 2 years until very recently. And it's funny because I'll get people calling in for colds, or they'll have bladder infections, or they have a sinus infection. And, I'm seeing here, oh, look, they have diabetes, they have high blood pressure, they have rheumatoid arthritis, they have, psoriasis, asthma, you name it, all those things that can be helped with a plant-based diet. And I really learned to hone in on those really helpful things for patients to do. Because if I only have 10 or 15 minutes with you, I need to give you some really high value advice and motivation. So the way to do that, number one, is I always require patients to sit back and think about what it would be without this chronic disease that they're walking around with. You know, for an asthmatic, it's like, imagine, you know, if you didn't have to use your inhaler every time, you know, the fall season came around, or what if you got a cold that you're not having trouble breathing and you're calling in and you're wheezing, or if you have allergies, or what if your eczema disappeared? So these are all these things that I imagine. I say, like, listen, now this is your present state of affairs. What if we change it just a little bit? You're just move things slightly by just changing what's on the end of your fork. Imagine life without it. And so just getting them to imagine a life that's very feasible. Here I am as a physician telling them that it's possible. And that's really cool, because that's that positive thing pulling them. The negative is they don't like the medications. They don't like not feeling well. That's pushing them maybe away from it. So that's the first start, is just getting their frame of mind correct, right? Thinking about a different possibility. Because all it is a matter of giving someone hope and giving them the permission to believe there's a different outcome for their future. And once you do that, people are like, that's really cool. I want to do that. And so then the next step is, of course, you know, good old forks over knives, get that emotional levers being pulled. I refer them over, if they have diabetes, to the Mastering Diabetes. I send so many people to you guys. You have no idea. And we, you know, just so you can watch your incredible videos, join your coaching program, should they choose to do that. We certainly refer them to Dr. Greger's nutritionfacts.org. I'll say, type in diabetes, type in asthma, type in acne, whatever it is that you're suffering with, and just learn how diet can influence your total health. And then lastly, I use Dr. Greger's Daily Dozen. And, you know, I just like, this is it. If you can't just do anything, don't even worry about the other stuff. Just eat all these foods first. And if you're still hungry, okay, whatever you want to eat. But just focus on that first. This is how to help them wrap their mind around, what does that include? What does it mean, a whole food plant-based diet? What does it mean, fruits and vegetables and whole grains, beans and nuts and seeds? And maybe a little education on B12, but that's pretty much it. And then, of course, I do close follow-ups with them.
One thing you focus on with the Healthy Human Revolution team is behavior change. So maybe, I'm sure there's people listening to this, they might know all this information, they've already seen forks over knives, they're trying to make changes, and they might be struggling a little bit. So what type of tips would you give to somebody who's in that position?
Actually, those are our favorite ones. So these are the ones, our people that we really like to work with are those that have really tried and struggled and failed. So the nice thing about that is that we don't want people to think of this as just another diet fad and like, oh yeah, I've tried it and I failed and nothing's going to work, so I might as well just go back and eat the way I want to. Because it's nothing more frustrating than seeing someone really try, but have just a little tweak in how they're thinking, or a little tweak in a habit, or a little tweak in being prepared for a struggle or something that's a continual thing. Like maybe they get stressed at work and they drive by McDonald's, you know, just helping them understand that preparation is really key. Maybe thinking differently when they're in the middle of a struggle, working through anxiety and some things. That is really powerful, because now people see that they are in charge of their lives and not these cravings. And so I think that's the cool thing, is that we focus on not so much replacing the behavior, the the unhealthy behaviors, like let's say smoking, with something else like eating, or trying to get people to rearrange their whole lives to work around this habit or these cues that are causing them. What we want to do is really make the reward of eating, you know, processed foods or junk food not so glorious and not so compelling anymore. That's part of our work. But the other part is just helping people with the understanding that this is all between our ears. And it's a matter of changing our thinking and changing the understanding that you do have the power to do it, and you just need a little bit of help. So, for example, I had one very recent patient who's a beautiful person. And what was amazing was she had struggled with being overweight her entire life, close to 300 pounds. And she pre-diabetic, but she also struggled from depression. And depression is a tough thing because it's not very well understood. our treatments for depression haven't changed much in the last 40 or 50 years. Every young person, I mean, I would say of all the young people, I would say at least 30 to 40% of them either say they have anxiety or depression or are being treated with some type of medication. She had failed multiple medications and just always felt like she was never in control, right? So she was like, she'd go to therapists and they would tell her, try harder. Why aren't you doing this? And almost making her feel worse. We started working together. She tried, a variety of things. But it wasn't even so much the whole food plant-based diet. Of course, I got her on the plant-based diet, but the switch for her was understanding after we had talked was that when she was stressed, that she didn't have to go drive through the fast food restaurant. What she had done is she changed how she thought about the incident and sat down and was mindful of the experience and mindful of what was going on in her body and those feelings and those rush, the anxiety, and just talked herself through it and walked herself through it. And that gave her the strength to say, you know what, actually, I don't want to do that because I know what's going to happen afterwards. So it gave her the power to have control over the craving, and the craving just passed. And she goes, the week before, she had this amazing switch. She goes, I've never had that much joy and feeling so confident that I can do this. And she lost, like 5 pounds in a week. It was the first time that had happened. And it's like, that is amazing. So that's the cool thing. It's awesome.
Yeah, I love where you're going with this actually, because, just making the mental switch to say, number one, this is possible. I can get to this ideal body weight or this ideal picture of myself. I can get to this end goal of what I actually want my health to look like. But then also becoming fully committed to the process where when temptation sneaks in, when it's Thanksgiving, when it's Christmas, when you're at the ball game, all of a sudden you say, you know what, last time I did this, it didn't work. I didn't feel good.
Right.
I had a difficult time losing weight. I became inflamed. I got nauseous. My blood glucose went up, and the list goes on. But it can be hard, I think, at the very moment that the temptation sets in, because somebody passes you a hot dog, as an example. If you like hot dogs and you look at it, and the smell can be overpowering, the sight can be overpowering, and the emotions that it conjures up that are sort of like, oh, I might get a dopamine rush if I, consume this. It's like, it's hard to convince yourself at that moment in time that that's not a wise decision.
There's some really interesting research by Dr. Judson Brewer, and he's an addiction psychiatrist, good friend of mine. He's at Brown University. And this is where I really understood the power of changing in the habit loop, right? So you have your cue, your behavior, right? Is the action, the eating, the smoking, the whatever, and the reward, the dopamine rush, the feelings of like, that tastes good, the salt and the fat in your mouth, whatever. But so let's say you get that hot dog and you're at a baseball game and it's your surrounding and the crowd, and you just want to be involved, and everybody else is drinking their beers and eating their peanuts and eating their hot dogs, right? And you want to be a part of that. But the thing is that what we help people understand is that when you see the hot dog, yeah, you might get those initial rush feelings, but what's cool is if you talk someone through that moment, right? So you see the hot dog, but what I want them to think about is there's almost like a third person objective. Think of it as like your little angel on your shoulder, right? So they're like going, okay, so here's this hot dog. I have a decision to make. I can eat it. I know what will happen, right? I'm going to think about it. I smell it, be there with it, right? Craving, seeing it. What's that to do? I eat it. I'm going to feel tired. I'm good. Like you said, I'm going to get inflamed. My blood sugars are going to be out of control, all those things. And then you think about, do I have to have this? Because what happens if I don't? What if I pass this up and I eat the banana and apple that it came with, or, you brought with you something else, just something different, or just saying that, you know what? I don't have to have this because I don't want what's going to be it. This is not such a great thing after all. I can enjoy the game still. I can still be with my family and not have to suffer the consequences of those few moments of eating this food in my mouth. And so that's the powerful thing. And then, because then you look at the hot dog and you're thinking, wow, this is really, it's going to deliver sickness and fatigue and not feeling well and a headache or whatever it is, upset stomach, heartburn. It's not such a great reward for me after all. So they set it aside and the craving passes and they're able to go on. It's just being mindful and present at that moment of the craving, so, or the cue. And so that's really the thing that I've really learned from Dr. Brewer. He's got some amazing, if you go to drjudd.com, J-U-D, Dr. Judd, he's got some awesome stuff. His TED Talk had over 16 million or 10 million views in 2016. So amazing. And he's plant-based, by the way. So you should definitely check him out. He's amazing. Absolutely.
That's phenomenal. That's phenomenal. Yeah, that moment, I mean, I think we've all been there before, you know, where that something tempting comes into your consciousness. Somebody presents you with some food that you that you weren't expecting, or you know, you start conjuring up the thoughts, you start smelling something from as you drive by a restaurant. Oh, I want some pizza. And at that moment where all of a sudden you're like, God, I really want to eat that. That's the moment, just like you're saying, right? So if you can exert some control over that, breathe deep and think, okay, let me just pass this literally 10 seconds, 20 seconds. It's not going to be as tempting 20 seconds.
Right. You're riding the wave. Think of it as if you're a parent and you're raising children, right? I love using children as excuses because I've raised 3 and that's majority of my life has been a mom. So when you think about when you raise kids and you're trying to teach them to act well, right? So let's say that, for example, my daughter would kill me if she knew I was telling you guys this, but I'll do it anyway. So when she was a young elementary student, she got in trouble for passing a note. Okay. So, you know, most parents may have said, oh, you don't do that again. But I really wanted to make an impression because I wanted to understand that there are rules to be followed. Yes, it was a minor infraction, but this is still a big deal because these little behaviors can lead to bigger behaviors. So I made her write a note, said sorry to the teacher, and we went in person. And mind you, I was a medical student at this time. I didn't have a lot of time, but I wanted to invest in my kids. I consider kids as a garden, right? You got to tend them, you got to pull the weeds, and sometimes it's uncomfortable. So we were going to pull this little bit of a weed. And so what we did is we went into the school. I said, okay, Emily, you need to apologize to the teacher, hand her the note. And her teacher's like, nobody's ever done that before. I was like, well, you know, I want to raise good kids. So, and guess what? I never had a problem. Not that I probably would have not anyway, but just never had a problem with her passing notes or doing things that she knew she shouldn't. It's the same idea, right? She's gonna, if she would have ever been tempted later on, which I'm sure she was, is like, my mom acts on these things, and I'm not so sure I want to go through the negative reward of accepting this, you know, knowing that moment of the temptation of looking cool to her friends or doing whatever. That's the same idea, right? So it's teaching these teachable moments with our patients, in that they are in control and they don't have to suffer the negative consequences, because there will be negative consequences. That's just the way it is. That's the rules, unfortunately.
Okay, Laurie, we got one more question for you. So if Cyrus likes to put the question this way, so I'm going to copy him. He says, if you're in an elevator, all right, and you're hanging out with somebody and you just have a limited amount of time to encourage them to open their mind to a plant-based diet, what would you tell them?
If I just had so what's my other elevator pitch?
Yes,
basically?
exactly.
I would say this. I would, first of all, if you're think of it as you were the salesperson, right? You're a marketer. It's the same thing if I was selling a business or selling an idea. If I needed to sell a car, you have to be the passionate, right? So that's one of the things that I think that happens with my patients, is that I get so excited about their future. So let's say I had just that moment. I would say, listen, did you know that your future could be different literally by changing what's on the end of your fork? And there are 3 things you need to do. Watch Forks Over Knives, check out nutritionfacts.org or masteringdiabetes.org, and follow these few simple things. It's a whole food plant-based diet. It's fruits, vegetables, beans, whole grains, nuts, and seeds. Give it yourself 30 days. I think you'll be surprised at what's at the end of the 30 days. The person in the mirror today is not going to be the person in the mirror in 30 days. And so you don't have to suffer from chronic disease. It's a choice.
Yeah, that's actually a really good point, right? Chronic disease is a choice. And I think a lot of people don't necessarily believe that because you've heard it before. Oh, my dad had heart disease. My mom had diabetes. My uncle had kidney disease. Therefore, I'm at risk for it, right? And we do know that, you know, there are small genetic variations, right? Small genetic determinants that can increase your risk for a number of chronic diseases. However, your lifestyle is the most important thing that's going to determine your true risk for developing any chronic disease. So I think you just nailed it, hit it on the head there. But more importantly, Dr. Marbas, thank you for what you do. You have so much knowledge, so much insight, and you've helped out not only the people from the Mastering Diabetes program that want to work with a telemedicine provider, but I need you through podcasts, through speaking engagements, through educating the medical community. You're really doing an exceptional job of teaching regular people as well as medical practitioners how to adopt a plant-based whole food diet, what are the benefits of doing it, and how to help, how when teaching when you're teaching doctors, how they can teach their patients how to really sustain this lifestyle over the course of time. So if we haven't said so already, we totally appreciate all the effort that you put into this. You're really changing lives, I think, more than you will ever know. And the fact that you're, so committed to this cause is something that we really admire. So thank you so much for your time today, and keep up the good work.
Well, thank you. And I'm just always so honored to be on your platform. And I so enjoy talking to both of you guys. So thank you so much.
Absolutely. So tell us also, how can more people find out more information about you? Where should they go? How should they follow you? You tell us.
Absolutely. Thank you so much for letting me share. It's the healthyhumanrevolution.com website. It has the podcast, the YouTube. We have the free information, the courses, and some different things. And we've got some really exciting stuff coming up in the next year as we continue to grow and evolve and really hone in on how we can help patients or people or clients or anybody who wants to join us understand and stick to this way of living. It's easy to get the science and get excited, but the hard part is the day-to-day decisions that go into continuing it. And so that's really what we want to do to help people